Well, good afternoon, everyone. I'm Anna Hoover. I am co-director of Systems for Action and an assistant professor in the Department of Preventive Medicine and Environmental Health in the College of Public Health. As co-director with Glenn Mays of the Systems for Action program, it is my privilege to be here today to welcome our speakers and to tell you just a little bit of background about the work that we do so that you have a better understanding from whence some of this work comes. Systems for Action is a new initiative of the Robert Wood Johnson Foundation. It is a research initiative looking at how to build a culture of health in the United States. From a systems perspective is our focus. We are looking at several elements of the Culture of Health Action Framework, which is designed to help make sure Americans live the healthiest lives possible, regardless of geography, demographics, socioeconomic status. So we are leading one of 3 research initiatives to help examine specific elements of the Culture of Health Action Framework that include making health a shared value, include fostering cross-sector collaboration, creating healthier, more equitable communities, and strengthening the integration of health services and systems across a myriad number of systems. So before we get started, I want to recognize the other Systems for Action staffers in the room in case you have questions about Systems for Action later. C.B. Mamerle, Dr. C.B. Mamerle over here, is a professor of health management and policy in the College of Public Health. CB does a lot of work in our cost and value portfolio and works with our practice-based research networks. Kara Richardson, fiddling with the camera there, is our communications director, and we are very privileged to have her on our staff. Nicole Howard, who I think is still out in the hall, has been managing some logistics in terms of making sure everybody here gets fed. So be sure to thank her when you see her. And especially Ann Kelly, who has done a whole lot of cat herding to make this day happen. So many thanks to Ann for all that she has done. I also bring greetings from our director, Glenn Mays, who could not be here today, and Lizeth Fowler, our deputy director. Though they could not be here in person, they are here with us in spirit and are very excited about this work. Systems for Action just launched a couple of weeks ago. This is the website. I'd like to encourage you all to visit this website because on it you're going to find a research portfolio, a research agenda that outlines the priorities for this new initiative. And among the priorities for this new initiative is a whole set of priorities dedicated to knowledge management and information flows across systems, which is why these 2 projects we're getting ready to hear about bridge the public health services and systems work that we have done in the College of Public Health for many years and the Systems for Action work so very well. As the National Coordinating Center for Public Health Services and Systems Research, we were able to manage more than 150 grants funded by the Robert Wood Johnson Foundation that looked at the organization, financing, and delivery of the public health system in this country. Among the grants that we funded were Mentored Research Development Awards, and our 2 presenters today come from that particular set of grants. So it is my privilege to introduce to you first off today Dr. Erika Martin. Dr. Martin is the Associate Professor of Public Administration and Policy at the Rockefeller College of Public Affairs and Policy and Senior Fellow at the Nelson A. Rockefeller Institute of Government at the University of Albany, State University of New York. Dr. Martin.
Thank you. Now we'll see if I have technology skills as someone doing a project in open data. So thank you for the warm reception. I have to say that I'd never been to Kentucky before getting this award, and every time I've come, this is my 3rd time. I'm totally in love with Lexington. Everyone is always a great host and hostess, and so thank you for the opportunity to come. So this is almost about 3 months left on this project, and it's a project that's really looking at open data platforms and the rollout of open data. And we're specifically thinking about what's the quality, usability, and fitness of these new data resources for public health research. And following Robert Wood Johnson's focus on public health practice, we're really trying to provide some recommendations on how do we make a more sustainable open data ecosystem. In terms of acknowledgements, this is one of the RWJ grants. My mentor on the project is Gus Burkhead, who was Deputy Commissioner of the Office of Public Health and also on faculty at UAlbany. Courtney Burke, who is the Deputy Secretary of Health, and Teresa Pardo, who does a lot of work in digital government. And I've ended up on this project amassing more and more collaborators, and so I've also really had the privilege to work with some really great doctoral students on the project. And just as disclosure, Gus Burkhead, Ian Brissett, and Natalie Helbig are all employees of the New York State Department of Health, which is actually one of the open data platforms under review. So my agenda for today is I wanted to spend a little more time than usual on the study motivation because I think open data might be a new topic for some folks here. Most of my talk will be on the overview and early findings for my project, and then just translating the results to practice. So based on the preliminary findings, what are the recommendations that we can make in terms of improving the value of open data and making it more sustainable? This is where my technical skills end. Let's see. Clickers always work too. Okay, so what are the promises of open data? So as background, there's been a movement towards open science. This has turned into this movement on open government and government transparency. And as a result of this, there are thousands of data sets produced by government that are being released on these big open data platforms at the federal, state, and also local levels. The presumption here is that data that's produced by government with taxpayer resources should be made available to citizens before they're requested. And open data are different than big data. So open data, they're kind of 4 features is that they're publicly accessible, so you can go and you find it yourself. It's available in non-proprietary formats, so not just having things in SAS files or Access files, but they're also in CSV and TXT files. Being free of charge, so you don't have to pay to use them, and with unlimited use and distribution rights, which means that you don't need a data use agreement. You just go and use the data for your purpose. And what's exciting is that there are a lot of new opportunities for public health research and practice. So we have a couple papers already out on just examples of how open data have already improved health in New York State. So a great example is one of our first data sets was the nursing home bed census. Our former commissioner said that this was the most boring data set ever. Why would you ever use this? But what happened is before Hurricane Sandy hit, people in nursing homes were able to go and actually see where are their free beds, and they were able to then redistribute where nursing home residents were. And we'd also done some preliminary work on how open data could also be useful for public health research. So if you've never seen an open data portal, these are 3 examples of them. So on the top left, we have Health Data New York, which is a New York State site. There's also a screenshot from healthdata.gov, which is the federal portal, and then also something from New York City. And what's exciting is that they actually have tools so you can search for data products. And so you go in and you type in the search tool and you can find what you're looking for. As a user, you can actually interact directly with data in the platform. So this is a screenshot where you can actually click on the little dots and, no, I can't. It's different facilities from health and hospital corporations. And so you can click into the dots and kind of look a bit more about the data points. There are a lot of innovation challenges for developers. So New York State Department of Health has a codathon. I just came back from Health Data Palooza, where there's also a lot of innovation and focus on developing apps. And then part of citizen engagement is that there are also opportunities that you can submit your ideas for what kind of data sets you'd like to get, and also just to provide some feedback. So this is part of open government in general. It's actually engaging citizens as part of the co-production process. So this sounds great, but there are a lot of research gaps. So a lot of the movement and momentum is really focused on app developers or using data for data journalism. There's a little less thinking about to what extent can these resources be used for public health research and practice. So are they usable? Are they fit for use? How can we improve the quality of the data and the corresponding metadata, which is data about the data, like data dictionaries? It's really unclear what the perceived value is of releasing open data. So there are directives that agencies have to release the data. but the people releasing the data, what do they really see as the potential opportunities? What does it take to actually create a successful and sustainable open data ecosystem? And ultimately, for this project, we're trying to use this information to think through how do we develop a robust community of practice that's oriented towards using open data for public health research and practice. So how do we get people to use the data successfully? So in my project, it's a mixed method study. So aim one is I did a systematic review of data offerings in 3 open data portals to figure out what's there and what's the quality of the data. I'm wrapping up aim 2, which is I then did some key informant interviews with folks at the federal, state, and local levels on what are the opportunities, the challenges, and lessons learned from releasing data. So from their perspective, what does it take to release a data set? And then the last part is I'm actually trying to do a use case to see, can I actually use open data to do a real kind of epidemiology research project? So we're specifically looking at childhood obesity in the built environment. And the goal of this is to ultimately provide some recommendations for practice. So we want to think through how do we improve open data? So it's early in the movement, so how do we improve the quality of the data? How do we sustain the efforts? And again, about building a robust community of practice. So knowing that it's kind of a 30-minute talk, I have more slides than I need, so I'm going to gloss over methods, but I'm very happy to take questions afterwards. So the first project is that we were doing a systematic review of data offerings in 3 different open data portals. What we did in terms of the research design is that we did a systematic review. So what we did is we took the information from Institute of Medicine, puts out some pretty formal recommendations on how do you do a systematic literature review. Pcori has updated them. So we adapted that. And what we did was we looked at what are the different offerings on federal, state, and local platforms. So if you go to the platforms, you can search for things, and the data offerings is what we were looking at. So we looked at healthdata.gov, which is the federal community, Health Data New York, which is the state portal that's only focused on public health data, and New York City Open Data, which covers all of New York City's products, but we were specifically looking at the health offerings there. And we took a random sample from each of them. And then we created a fixed coding guide to evaluate different dimensions of data quality. So we considered both intrinsic data quality, which would be things that all of us would agree on are part of high-quality data, such as completeness. Contextual data quality, which are things that, depending on who you are as a user, you may or may not find it particularly important. So for example, a health researcher might actually want historical data. An app developer might really care about the most recent data. Health researchers might care a lot about having specific types of aggregation or certain demographic characteristics. An app developer might not be quite as interested. Metadata, so this is data about the data, so we're looking at the quality of that. Where the data sets are in terms of 5-star open data deployment, which I'll explain a bit about that. And then also, how usable is the platform? So for the sampling design, we ended up looking at all of the New York City open data offerings related to health. We did a 25% sample of data objects from New York State, and then 5% from federal objects. And in terms of the coding guide, no one had done this before, which is exciting, but it also made it a little challenging to come up with a coding guide. So we did a pretty extensive literature review to think through what's a conceptual framework of data quality, usability, and fitness, and specifically for public health. We had a lot of stakeholder conversations, and then we also got feedback from things like different focus groups we had done. We did a blog post to the SAS user group at the Department of Health. We had a pretty extensive pilot testing phase of our coding guide. This thing ended up being 99 questions, so this was quite extensive. And then we transformed it into access for data entry. And then we also had a separate guide to think through platform usability. So we had 5 different categories of questions. So we wanted to know something about descriptive information. So essentially, what kinds of data objects are there? What's their unit of analysis? What kinds of variables are there? Intrinsic data quality, so I talked a bit about that, but these are aspects of data quality that any user would be interested in. We had questions looking at contextual data quality. Adherence to the Dublin Core International Metadata Standards. So what this is that, so metadata is data about the data, so it would tell you some context about what are the different variables, what do they mean, how are the data collected. And there's some international standards that are evolving, and so we ended up taking all of the items from there, and then we added a few others to that list. So that's how we pulled that information. And then the last thing is that we were really interested in where open data are in terms of 5-star open data. So there's sort of this aspirational goal that open data should be 5-star. So 1 star would just be that it's on the web. So by definition, all data on a data portal are on the web. They're 1 star. 2-star would be making it available as a structured data set. So rather than a PDF document where you have to copy and paste numbers to make your own data set, this is something that's already structured. 3-star data would be those first 2 things, and in addition, you have non-proprietary formats, so you're using a CSV file instead of Excel. 4-star is that you can actually point to things, so you have URIs or other ways to identify the data. And the 5th one is very aspirational. It's linking your data to other data to provide context. So what this means is that if you had a data set about temperature, you could hover your mouse over the field that says temperature, and it might link you to another website that would explain what is temperature, how is it used. So main findings. Only a quarter of the data offerings are actually structured data sets. This was very surprising. I'll explain a bit about what the other ones were. So only a quarter of the things that are out there are things that you and I would really think of as being traditional public health data sets that we might want to work with. Most offerings do not contain demographic variables, the kinds of things that we would commonly want to use in public health research. When we compared the different platforms, Health Data New York, which is the state portal devoted to open health data, scored the highest on intrinsic data quality, contextual data quality, and adherence to the Dublin Core metadata standards. And we found a lot of gaps with meeting these different open data deployment criteria. So all data offerings were 1 star, that they all were available on the web. But fewer actually got up to the 5th star of also being hyperlinked to other data to provide context. So this is just sort of a descriptive table in terms of what kinds of information was out there. So the first column that you see is the information for New York City open data. The middle column is Health Data New York, which is our state portal. And then the one on the right is healthdata.gov, which is the federal portal. And the first item up here is the primary presentation format. So here, this is where only a quarter of them overall were actually in some sort of tabular form, which is what we would traditionally expect to see as a data set. Other kinds of presentations included charts, maps, APIs. There were a few query tools. And some of them were actually just documents about a data. So there was something like a PDF file that said, here's a report about the data. Not all of them had different kinds of presentation formats. Health Data New York had more data sets that you could actually, if it was in a map, you could also find it as a structured data set. There were some problems with actually viewing the data in a browser. This was especially the case for the federal platform, where you would click on things and there might be some broken links, or else you would get directed to another website in order to access the data. Other kinds of things is that some of the data were pretty static, so it might have been a one-time data set like a survey. Other things like nursing home bed census are things that get updated on a weekly basis. And another thing just to point out was just the inclusion of demographic variables. The slides are here if you want additional information, but just the idea being that in general, most of these data sets don't contain the kinds of variables that we usually think about with public health research. And in terms of the size of the data objects, there was huge variation. So some of them were millions and millions of records, and some might have been, just a few lines of data. So what we have here is that we took all of these 99 questions and combined a lot of them into 3 main indexes. So we have, in black is our index for intrinsic data quality. The middle shading is contextual data quality, and the light one is for the adherence to the Dublin Core metadata standards. I don't take too much stock in terms of what the actual numbers mean since we kind of created these scales. What's important is to think through how are the 3 platforms comparing. And you see that the one in the middle, which is healthdata.New York, overall it just scored higher than the other 2 platforms in these 3 different areas. And this slide just shows different adherence to the 5-star open data deployment scheme. So the black is the data set meets the 1st star of open data, all the way down to the light is meeting the 5th star criteria. And what you can see is that, again, I think Health Data New York is scoring higher overall. What's interesting is that the New York City portal, there are no data objects, at least when we were doing the review, that actually met the 5th star criteria. And at the federal level, it's 12% of the offerings were meeting this criteria. So and 35% overall met all 5 criteria. When we think about platform usability, there are some common features that are pretty exciting for public health research. So data are hosted on platforms, so there might be links to external pages where relevant. So one of the things that was very exciting in New York State was the release of our Sparks data. This is hospital discharge data, and so normally you have to know what page to go to on the Department of Health. Now there's an open version of Sparks, and so if you find that in the platform, in the metadata tab, you actually find some links to that section of the Department of Health. In New York, there are some open data handbooks that are out there that guide standardization of metadata and some of the vocabulary, so they're trying to put up some standards. There are a lot of different ways that you can search for and download data offerings, announcements for developers. There's actually help functions. And a lot of this is designed to engage the public. So in particular, New York has done a really good job with thinking through storyboards and messaging and trying to put out messages along with their data. But there are some areas for improvement. So one of the things we found is that healthdata.gov is mostly a search engine. There are technical problems, low visibility on Google searches. I'm going to actually plow ahead to the rest of this, just kind of looking at time. So in terms of the second part, which is that we really wanted to understand what are some of the challenges to releasing data. We talked with about 40 people in New York State, the federal level, and then other jurisdictions. We were talking about what's the value of releasing data, why are they doing this, how are they doing it, and what are the challenges to doing so. And then we were systematically analyzing the qualitative data with a grounded theory framework. So when we were interviewing people, we got people in a wide range of roles, from executive leaders to program directors to legal affairs to independent contractors. And our focus was actually on early leaders. So we started out thinking about New York State, and then as we went on, we learned about a few other innovative places where we were speaking to. And we were talking about things like historical context, what are the benefits, who are some of the early leaders. And so our main findings are just that there's a really wide range of perceived benefits. So the movement has been started because there's this thought that this will improve government transparency. Really, only the high-level executives mention this as a benefit. Instead, there were a lot of internal benefits to departments of health. So they talk about their own data quality has improved. They have a few examples of how their own operations have become more efficient because they're releasing these data. External benefits include health literacy, so helping the general population have a better understanding of different health topics. Being able to use data to improve healthcare delivery, to help communities plan, and also to empower them to make changes in their built environment. Some of the technical challenges is that no one really perceives this as a technical issue. Rather, this is a management issue. It's a cultural issue. So the most important challenges were ensuring resources, thinking through cultural resistance, navigating the legal and regulatory environment, and trying to improve the quality of data and metadata. And what's great is that there was general optimism that this open data movement is going to continue to grow. But its success really depends on having sustained leadership, ensuring that you have adequate resources, having cultural changes, promoting the use of data because it's only valuable if it's used, and establishing some clear governance processes. So in terms of specific examples of benefits, people talked a lot about internal data silos. So they actually said that internal data silos are actually even worse than external. So there's perceptions that internally it's harder to get data than external users. Fewer FOIA requests. So there were 700 fewer requests in the first 3 months of launching the Open Data Portal in New York. Chicago has actually used their food safety data to figure out what are the worst places for violations, and now they're deploying their inspectors there first, so that's improved their efficiency. There was a lot of comments on how data quality, timeliness, and useful has improved, both in terms of external users finding errors. There were comments about how data, there's not always great information about the data and documentation, but this has forced the department to be better about its metadata. And also there's different kinds of analytic tools for end users so that people without really sophisticated technical skills can now actually do some simple things in an open data portal. The idea that external researchers have better access to data, so this expands the bandwidth of what DOH can do. And also lots of examples of being able to use data to actually improve healthcare in the built environment. For health literacy, this can include just promoting awareness of health issues, helping people make better decisions about which restaurants to go to, or locating medical providers. The creation of new applications, so there's this nice I Choose 600 application to help you find, if you're at a restaurant, what are the things with 600 calories or less. And again, promoting government transparency and fairness was mentioned by a few people, and predominantly high-level executives. There were challenges. Human resources, it's a major one. So 1/10 of the public health workforce in New York State retired on the same day as part of our ways to save money at the state. It's hard for staff who are grant funded to move them over to broader open data activities. Some comments about you have different kinds of technical skills required to release open data. Cultural resistance was huge. So there's huge data silos, sort of a feeling of this is my data. Why should I release it to you? Why should I give it to you? No one will understand my data. And it's also just a new business model. So the health departments are used to creating their data, working with smart epidemiologists, making some sort of data report, and then not really releasing the data. So this is just a new way of doing business. One of our findings is that there's a very complex legal and regulatory issues. So there's federal laws, there's state laws. Each data set might have its own issues, restrictions. Data and metadata quality, especially a lot of them is around interoperability. So there are not standard definitions for data elements, which makes it hard to link data sets. There's a huge tension between maintaining value and minimizing disclosure risk. So as you release data, you need to make sure it's de-identified. But as you strip away data elements to make it de-identified, it loses its value. So there's this really big tension, and it's hard to think through what's the optimal threshold. And I think the usual technical challenges that are not surprising in terms of legacy systems. There's frustration that the open data software, it keeps getting better. But there still is a need for additional stuff, like it's not user-friendly. People want query tools. It's not there yet. There's knowledge gaps in terms of people don't know who the end users are. So they're used to working with researchers, but who knows who are the citizens and what are they wanting to do with data? And similarly, how do we address the needs of diverse end users? So in terms of strategies and lessons learned, people said that executive leadership and high-level champions are absolutely critical to the process. This is what has moved New York ahead. You need to have sufficient resources both for technology, but also for human resources to ensure the sustainability. And it's possible to overcome cultural resistance. There's been a lot of changes at the federal level, especially in New York State. But to do this, you really need to understand culture. You need to do a lot of work to meet with staff, work with data owners, and kind of find some early win data sets so that people can see the value of releasing the data, and that starts to overcome these fears and resistance to doing so. And also people talked about that it's helpful to have status reports that show the impact. So saying, here's an example, if we released your data set, these great things have happened. Other kinds of things is having some processes to facilitate your legal review, thinking very strategically about improving impact, so understanding your audience, starting with a few high-interest data sets. So we actually have baby names in New York. It has no public health value whatsoever, but people get very excited about it. So it's strategic because it gets people onto your open data platform. And don't reinvent the wheel. So there's a lot of technologies out there. Don't build your own platforms. So the last part is I was doing a pilot study to say, can we actually use these data to do a public health project? And so we specifically were looking at childhood obesity in the built environment. So the rule on this, so our outcome data came from the student weight status reporting system, and so it has school district level rates of childhood obesity and overweight. We picked this because it has been widely publicized. It was used by a lot of media to showcase childhood obesity in the state. And our rule was that the only data sets we can use have to be open. So we can't get stuff from DOH. It has to be discoverable on the web. And as part of it, we were not just interested in the answer to the research question, but we wanted to understand, what are the technical challenges of doing this? So we ended up pulling different measures of the built environment and control variables. We had stuff from the Department of Agriculture. We had stuff from the Department of Education. School districts are our unit of analysis. And so just to skip ahead to the findings, I actually don't have the answer to the statistical questions yet. That's pending. We've got a few months left on the grant. But I can talk a bit about some of the challenges of using the data sets. So the first is that there are a lot of data sets that are available for public health research. What was great is that we could actually synthesize data from different domains. So we had stuff from health, agriculture, and education. This is one of the promises of open data, is that you can actually do linkages across sectors. And we actually had to use data in a very creative way to get our measures. So, we're actually showing that you can use these data sets in different ways from what they were originally intended. All of the challenges that we've had working with the data are exactly consistent with the other two aims in terms of hard to merge stuff because of non-standard definitions for data elements, incomplete data, metadata. So despite us working hard to have metadata, they just are not complete. We were missing code books. We had issues with data quality, some of the timeliness. So our data are from several years ago. Some of the data, especially for the education data, it's actually not easily discoverable on the web or on open data platforms. We had to know about the data set, and it took us a while to find it buried in some web page. Data are definitely not yet 5-star. And even though the promise of open data is letting other kinds of users use it, the research assistant who's working with me, fortunately, he has very strong R coding skills, because otherwise we never would have been able to link these things up. So there's a lot of behind-the-scenes work that still needs to be done. So this is just an example of kind of the maps that we're producing that showcases difference in obesity and overweight across the state. So I'm going to skip through these. I'm happy to talk a bit more. But I want to really get to the fun part, which is, how do we actually increase the value of open health? So some of the implications for policy and practice is that there's mandates to release data, but very limited guidance for government agencies. Open data are valuable, but only if they're used. So we've learned from our interviews that really there is an open data ecosystem. It's starting to emerge. It's bringing in a lot of new users. There's a lot of opportunities. But what's exciting is that because this is so early in the movement, we also have a lot of power to actually make some changes now that could really increase value. Currently, the current policy climate is actually pretty supportive of this. I mean, there's pockets of resistance, but in general, it's a pretty supportive climate. But we really need to demonstrate the return on investment of this, because if leadership changes, then the movement, could stagnate a little bit. And I think that that's sort of another area of research that we could think of. And we just need to have sustained effort to really improve usability and quality if we want to ensure their value. So to improve the quality and usability, some suggestions that we have is actively engaging consumers to understand what they want. Focusing on standardizing data elements. So this is a very lofty goal, but I think this project really shows that this continues to be important. Focusing on metadata and making sure it's high quality. It takes a lot of time, but it's really important. Thinking about ways to make your data more discoverable so people use it. Using different kinds of formats, so really trying to push things like CSV files, flat files instead of SAS or Access. Continuing to push vendors like Socrata to keep developing their software to make open data platforms more usable. And I think that there's sort of a whole theme on how do we deal with disclosure risks. So I think that there's some work to be done in investing in technologies and staff training to help in this area. For improving impact, start small. Start with some high-value data sets. Use it as a use case and then build up from there. Don't try to dump 100 things on the web at once. Release data with public health messaging. Promote your data resources through public affairs. So the public affairs office knows that you have a data set on food safety. When the media call for requests, you can then point them to the data set. So that's sort of a way to improve the impact. I had the great opportunity to go to the Health Data Palooza. There's this whole movement around disruptive innovation. They're doing codathons. But something that there seems to be less of is thinking about this for public health audiences. So we're thinking that, ASTHO and NATO could actually play a role in targeting public health practitioners with this notion of disruptive innovation. That seems to be an area that's not focused on currently. I think continuing these difficult and sometimes frustrating conversations about how do we continue to improve data quality, investing in high-quality data. Don't reinvent the wheel. So New York is actually, because they're ahead, they're getting a lot of requests from other states and jurisdictions to learn about their open data handbook. That's a good place to start. And publicizing use cases. So data are valuable when used, so just being able to show the return on investment. For sustainability, leadership is critical. Really think about changing your culture. It's possible, but you need to work at this. Creating an open data handbook is great because you can communicate your vision for open data and you can establish governance. Having standardized processes, you can dictate this in your open data handbook. Something that was interesting in New York is that it started as a special project in the commissioner's office, and then they moved it to a program area. So now that the commissioner is gone, because it's in a program area, it's now a routine public health activity. So now there's no resistance of, well, the commissioner is left, so now it's no longer a priority. It's actually now a program. And just kind of collecting ongoing feedback to really make sure that you're on target with your project. And that you're actually able to document to your data owners, this is how the data are being used, here's some examples, and it helps people generate some new ideas. So with that was a whirlwind tour, but...
I think we have about 10 minutes for questions. So I'd love to take your questions from the audience. And while you think about those, Kara's got one.
We recently attended another lecture of the Kentucky Public Health Data Trust, and he was encouraging people to think about use cases and submit them.
Yep.
Sorry. And to submit them for consideration to help support
Yep.
just the broad thought process. So I'll comply.
No, I'll build on that.
Okay,
So have you given thought to, so you're talking about a process or a way or venue to sort of both encourage, these use cases or either document it or, so you mentioned a few use cases, like the one where your example, the pilot project with obesity.
Yep.
And then talk about how during Hurricane Sandy, you're able to use that data on the nursing bed homes, and of course in Chicago, they're using open data for the food safety inspections. So I guess you're trying to promote the use, and I think part of it is by promoting these, high value or interesting use cases. So could you speak a little more to that?
Yeah, so when I did my research in progress presentation, the webinar a few months ago, the practitioner who Department of Health actually suggested that we have as my commentator, Cheryl Wald, she's in California. She's actually been doing this as her special project, is that she's trying to publish all of these use cases, and so she's been in touch with me asking, do you have any other examples? So she's actually done a write-up of the school overweight obesity data. I'm sure she'd love to hear a bit more about the Kentucky data as well, because one of the things I'm hoping to do kind of after this project ends is to circle back to her. One of the things that I did code in my interviews was use cases, so I actually do have a stack of them, and I just need to follow up with the people who talked with me about them. And I think the one about the nursing home bed census, so we ended up writing a paper that is just an editorial in JAMA, and this was with the former commissioner, Dr. Shaw, and one of my collaborators, Natalie Helbig, and I. And so one of the reasons why it was important for us to do this is that it actually gave a little more excitement around open data. And so, all we did was talk about 4 use cases, but it was still exciting to actually be able to do it. So I think that that's something else we could do, is to just be doing more editorials and use cases in high-impact journals.
Other questions?
And
You mentioned for sustainability that we need to demonstrate ROI. So given all the aspects of this project, how would you overlay an ROI analysis, or how could you take it to the next level to do an ROI analysis maybe in the obesity area?
This is tough, and I think that this is just something, I have no clue how to do it. And I think that this is something that in the Department of Health, it's not clear how to do this either. So the easiest thing to do is to look at how many FOIA requests have gone down, because that's easy. You can figure out over time how many FOIA requests you tend to get, or how many queries you get on specific data sets, and what's the volume, how is that decreased. You can figure out what's the staff time to accommodate a data release, and then that's your return on investment. That's very limited because it does not take into consideration, well, what's the value of data in and of itself, what's the value of improving data. The McKinsey company has put together some sort of estimate of what's the value of open data. I'm not really sure what went into it. It might be a bit of a black box. They took a first cut. So I think that there could be a lot more work in terms of thinking through, based on use cases, based on other notions of data, what is the return on investment? And I'm not sure really what is the answer, but I think that that is really important for building sustainability and showing value.
It would be interesting to look at those data sources that you evaluated as useful and highly rated. What's the cost to develop them versus their ultimate value, even just to try to use them?
Right, and then, well, you have some data sets too, like the baby names. So you talked with people in the Department of Health about baby names. They roll their eyes. It's not useful for public health, but it does generate traffic. So how do you account for that? I mean, it's useful if it's generating traffic and excitement around open data.
How often do the public health departments track the usage of these data sets?
They are trying really hard. So our Health Data New York team, they're putting out, I don't know if it's monthly reports, but they are certainly doing a lot of work with web analytics to figure out what are the hits on the data. It's hard to track use cases because you have to know about it. I actually have a doctoral student who has been working with me on this project, and one of her dissertation projects is going to be using the web data to do some site analytics to figure out how are people using the data and what kinds of users are there.
Could that, follow-up question,
Yeah.
could that be a potential pathway to measuring ROI?
It could be. Yeah.
I was thinking about decision support tool, use of these data sets for different types of decision support as potential ROI, and to the extent that a public health practitioner does not have to go out and figure out which zip codes injury coming into the emergency department that can actually just look this up on a emergency department website or data set, even with the identified data, that saves a huge amount of time.
Kind of. In theory, yes. So one of the challenges and sort of next steps is that currently the platform is not very user-friendly. So it's just fine for a researcher. It's just fine for maybe a data journalist who's pretty sophisticated with data. One of the themes that came up is that currently the Department of Health, different programs have specific web pages. So we have a thing with the prevention agenda as this policy initiative. It's helping communities do lots of different kinds of planning. And so the folks running the prevention agenda webpage did a ton of outreach to their users to see, okay, practitioners, what kinds of things do they really want to know? How do we build our webpage? And so I can't even like wrap my head around it, but it's something like 300,000 web pages are rolled up into this prevention agenda website. So ideally, you want to move all of this to the open data platform and make it queryable. But right now, for these practitioners to go on the prevention agenda website, it's easy. For them to find the same information in the open data portal is really hard. So this is just one of the technical challenges.
I have two questions, and this could be just a lack of understanding on how grants work because I'm first-year student. But for in the beginning, you said the data is based on taxpayers, the taxpayers spend. So would that eventually include grants that fund like state universities that do research, like having them make that data? And then continuing on to that, if we're encouraging researchers to use the data, how will that affect their grants if they're using free information?
Yeah, good questions. Okay, so what should be available? I'm not sure that anyone has entirely defined what this should be. I think it's just sort of the sentiment that as a taxpayer, you're spending a lot of money for public health surveillance activities. You're spending a lot of money on the Medicaid program, and so some of this information on administrative data, de-identified, of course, like should be made available to consumers because you as a taxpayer have actually paid for this resource. So it shouldn't just be locked into a box that only a few select people can have. So that's sort of the idea behind it. I think considerations of exactly what should be on the open data portal, I think that there's less focus on that. So it's really not clear. There's directives that say release data. Governor Cuomo is telling all the different commissioners, thou shalt release data. But there's no real targets of how much needs to be released, how many data sets is enough. I think that part is the devil is in the details. Your other question is about once your data is out there, there's a fear that someone else can use your data. And so this is a major challenge. So this is actually part of the cultural resistance, is that you have people who spend their entire careers cleaning data, which is very important, very labor intensive, and not glamorous. But it's really something that they do. And so now there's a fear that, well, if my data is out there, someone else is going to make the discovery based on all the work that I have done. So this is also just a challenge and something people are thinking through in the open science movement. So there was some talk when I was talking to folks at the federal level about, this might actually start changing the way they do grants. And so currently, I'm creating this data set based on the review that I had in the open data platform. I don't know if I'm supposed to give the data set back to Robert Wood Johnson Foundation. But now there's sort of a thought that all this open data might prompt some reconsiderations of if you make a data set, who does it belong to? Is it you just as a researcher?
Do you think there will be a push? So you, I assume, get grant money for this thing, but because you aren't having to put in the work yourself to go to each school and talk to them about the obesity rates and all that, do you think there'll eventually be a trend for people to get less made because, or that they want more money to spend longer finding their own information, even though we already have a certain data set?
It's hard to predict the future. Yeah. I think it's just going to be different kinds of projects might be possible, right? So, one of the most exciting thing that people said is we just don't know. And that's really the excitement, is that, the tip of the iceberg is that you're going to have new public health data to do public health kinds of things. But all of a sudden, now you're able to connect transportation data and education data. Who knows what the use case is? Like, who knows how you could use that information? So I don't know if it would necessarily change grant funding to produce data, but it might change the way we think about how to work with data and what kind of questions we can answer. Related to grants, I think one of the excitements around researchers having access is not that they can do interesting projects. I'm sure that the project we're doing on obesity in the built environment could be better if we used proprietary data. But it's the idea that you can now do pilot studies. You can look at the open version of the Sparks data for hospital discharge and decide, okay, what are some of the variables I might use? Or what kinds of trends might I find for when I make my real data request for the more sophisticated version?
And I would add that grant making has already changed in many ways, with federal grants often requiring data sharing plans up front so that you are providing your data for other researchers in the same field, because it is funded, again, by taxpayer dollars. So you get into open science, you get into open access to journal publications because the research was funded by taxpayer dollars. So there's a huge discussion that's been going on for a while, and I don't see it ending anytime soon.
And now a challenge is, how do you cite the data? So the whole point of, data, not having use limitations and distribution rights is that you can go and use the data, but now there are no standards that say, well, this is how you reference an open data set. So, that's like another thing to think through, and that's actually why, in part, it's hard to document use cases. You can't just do a search for Sparks open data. You kind of have to know, like, okay, it would be hospital discharge data that was used. Hopefully. So this is kind of where it's new, and this is, I think, what the opportunity is this is starting to uncover issues like that, which would help us think through, okay, if we want to demonstrate value, maybe part of it is really starting to have better citation practices, because that way we can actually start to track the uses of the data.
I have one last question before we take just a brief break. You were talking about the importance of champions. And that's always important. Any public health research we find a project's implementation is better with champions. I'm wondering if you have looked at your data set yet, or if you have any intention of looking at your qualitative interviews, for example, to identify what are the characteristics of those champions as opposed to some of the folks who are perhaps more culturally resistant, because obviously we can't put a perfect champion in every spot, but if we can identify the characteristics for open data champions, then that might help us with training, with identifying the right people for the right job, those kinds of issues.
So one of the limitations is that we only talk to people who are excited about releasing data, because the people who aren't excited, didn't want to talk to us and wouldn't answer my emails. So this was a limitation. I ended up speaking to champions and different kinds of champions. And so one of them in particular, he's the person who's put out the childhood obesity data. He is just a mover and shaker. He's very enthusiastic for what he does. He believes in it. It's something that is so tied to the mission of his division. So part of his division is about release data, help people come to better decisions about their own health. And so open data aligns with his own mission and vision. He's also just very enthusiastic, and he's done a really aggressive job of promoting his use cases and how his data have been used. And I think that that's been helpful, and it starts to build the momentum.
Excellent. Anything else for Dr. Martin? Thank you so much for a great presentation.